Now that clients have been through the screening station, they'll take their screened forms and proceed to the dispensing station. Dispensing is the last major function that occurs during pod operations. Depending on state dispensing regulations, dispensers may be trained volunteers under the supervision of a medical professional, while others may be licensed medical personnel. Providing MCMs to the public is one of the main goals of a mass dispensing campaign. By dispensing medication, we can decrease the number of clients who become ill and ultimately save lives. To address a variety of client needs, pods should have multiple dispensing stations. Most pods have express dispensing stations for clients with uncomplicated medical histories who are able to take the primary MCM. In contrast, individuals with physical or cognitive disabilities, families with small children, non-English speakers, or elderly clients should be sorted into a dispensing line that addresses these clients' needs and may require additional time at the dispensing station. Whether you're working at an express dispensing station or a dispensing station designated to address a specific need, you will perform 4 main tasks when dispensing antibiotics. Task 1. Take the client's form and review the screener's notes to identify which MCM should be dispensed for each individual listed on the form. Task 2. Pull the correct MCM from the inventory stack, peel the label from the bottle, and apply it to the appropriate area on the form. This process is done for each individual listed on the form. Applying the label to the form assists pod staff in tracking client medication. Verify that the client knows the specific medication each person on the form is to receive. It's also important to note that the medication inventory should be easily accessible to you, but not to the public walking through the pod. If you see medication placement that could pose a potential security risk, immediately notify your supervisor. Also remember to keep an eye on your medication and supply inventory levels. If you notice your supplies starting to get low, notify staff members responsible for resupplying inventory. Task 3. Provide a bag with all of the client's medication and any relevant information handouts such as pill crushing instructions, medication fact sheets and adherence instructions, or websites that clients may use to obtain additional information. Depending on the requirements of your state, you may be asked to collect client forms at the dispensing station and place them in a specified bin. Verify the form collection procedure with your pod supervisor or manager. Task 4. Ask clients if they have any additional questions before leaving the dispensing station. In general, there will be a pod staff member at or near the exit reinforcing instructions or answering last-minute questions. However, it is best to address any questions before clients leave the dispensing station and proceed toward the exit. Should you come across a question you can't answer, direct them to your supervisor for further clarification. Now that you've dispensed the medication, provided health information sheets, and answered any questions, the client will proceed to the exit and leave the pod.